Good afternoon. Thank you so much for joining us for today's in-service training, the second session of Dietary Patterns in Health and Disease, Feeding Our Microbiota. There are 2 sessions still remaining in the in-service training series, November 17th, Diet and Microbiota and Health Benefits of Fermented Foods, and December 2nd, Guide to Home Fermentation. And we definitely hope you'll join us. Next slide. Today's in-service is brought to you by our multi-state team. From the University of Florida, we have, hi, I'm Wendy Lynch, FCS Agent in Putnam County, Julie England, FCS Extension Agent Emeritus, Kendra Zamoyski, Regional Specialized FCS Agent, and Dr. Wendy Dahl, Associate Professor and Extension Specialist in the Food Science and Human Nutrition Department. From Virginia Polytechnic Institute and State University, we have Dr. Carlin Raffi, Assistant Professor and Extension Specialist in the Department of Human Nutrition, Foods, and Exercise. And from Chile, North Dakota State University, we have Dr. Julie Garden-Robinson, Professor and Food and Nutrition Specialist with the Department of Health, Nutrition, and Exercise Sciences. Be on the lookout for a short Qualtrics evaluation that we'll send out after today's webinar. And if you're looking for a certificate of attendance, it will be available to you at the end of that Qualtrics evaluation. Just a special note, the certificate of attendance will only be accessible for those who are participating in today's live session. So all sessions will be recorded also. So if you're not able to make it, or for those of you who are listening to this later and you've received that link to the recording, it will be, again, emailed to you. And we encourage you to share this in-service training with your colleagues because there's still time to register for the last few sessions. Not that any of us need a quick reminder, but just as a highlight of the Zoom features, where you're viewing today's presentation, you may have to use your mouse to hover over the page to get your tool options to pop up. And we encourage you to use the chat feature during today's session. So what you want to do is you want to click on that chat icon and a chat window should pop up. And using the drop-down menu, you have the option to compose a message to all participants and panelists or privately to panelists. And a quick disclaimer, this information provided is for educational purposes only. Reference to a commercial product does not constitute an endorsement by the webinar team members or their institutions. And I am delighted to introduce today's speaker, Dr. Rebecca Solch. Dr. Solch is a postdoctoral fellow in the Department of Neurology at Tulane University School of Medicine in New Orleans, Louisiana. She is currently working with Dr. Maraganori and Dr. Bix to explore the relationship between the Mediterranean diet, gut microbiota, and cognitive function in clinical and translational models. Rebecca obtained her PhD in nutritional sciences from the University of Florida, where her dissertation focused on evaluating probiotics on stress-associated gastrointestinal and immune function in undergraduate university students. She has been a co-author on publications regarding probiotics and fiber on gastrointestinal function and gut microbial composition in healthy adults. Without further ado, I'd like to welcome Dr. Rebecca Solch.
Thank you for that introduction. I'm very excited to be talking to you guys today about one of my favorite topics, probiotics. And so the topic of today will be the overview of probiotics in health. As I was nicely introduced, I got my PhD in nutritional sciences, and I'm currently a postdoctoral fellow at the Tulane University. And so after today's seminar, I'm hoping that you'll be able to define the term probiotic, identify probiotic characteristics and sources, and summarize health benefits in relation to probiotics, and more specifically with gastrointestinal and immune health. And kind of jumping back to the last seminar as a nice little refresher from Dr. Archer's The Zoo Within Us, I wanted to go over a couple of terms again, just to kind of reintroduce them, familiarize ourselves with them again. So gut microbiota is the totality of microorganisms and their collective genetic material present in the intestinal tract. Gut microbiota is the microorganisms of the intestinal tract. Dysbiosis is a term for microbial imbalance or maladaptation on or inside the body, such as impaired microbiota. And this kind of gives rationale for the use of probiotics if you have a dysbiotic state in your gut microbiota. And a really cool fact that I always love is the colon contains the highest microbial density recorded in any habitat. So it's just really interesting to me. And then on the right-hand side, we have a picture of the gastrointestinal tract, starting with the stomach, going down to the colon. And we can see that as we go through the intestinal tract, with the stomach to duodenum, jejunum, and ileum, we have lower amounts of microbes, anywhere from 0 to 10 to the third. But once we get into the distal ileum and the colon, we see this great increase in abundance of microbes. What's also really interesting is the differences in microbial compositions within those different areas. So the stomach, for example, has lactobacillus, duodenum has lactobacillus, jejunum, proximal ileum, and these are kind of abundant. But once you get into the distal ileum and the colon, other species or families, genera, kind of take over in the abundance. So we see different microbial compositions just within our intestinal tract. And so with the topic of probiotics, I kind of wanted to take a step back and think about our awareness of probiotics. We've seen them on the news, on TV, on ads when you walk in the grocery store. And so I wanted to see how maybe health professionals view them versus the general population. And so there was a survey of health professionals done in 2019. It was an international survey, and it had found that 87% of health professionals had taken probiotics in the past. They took it for antibiotic treatment, with antibiotic treatment, sorry, not for antibiotic treatment, for improved digestion or other issues like allergy, dermatological problems, or stress. And about 79% of them had advised their patients to use probiotics. They've received their information from books or expert magazines, internet, work, pharmacies, and TV. So we have the books and expert magazines might include journal articles, but then we do have some popular press items like TV or the internet. However, 58% of them wanted to learn more about probiotics. And hopefully you guys are all here today to learn a little bit more. Now, hopping over to the other side, the general population, this study is a little bit older. It was done, I think, in 2016, and they surveyed a population of people in New York at a farmer's market. And they found that 66% of people did not possess adequate probiotic knowledge. These researchers had actually created their own kind of questionnaire to ask people general information, what the definition of a probiotic was, what maybe some structure function claims were, how to take it. And from this, they found that a majority of people didn't possess adequate probiotic knowledge. On top of that, 57% of people did not consume probiotics because they did not know which type to consume. And this is always a question that I get asked. I'm sure you guys have been asked before, is which type of probiotic should I take? And there isn't that general blanket answer of, oh, you should go take this probiotic. And you guys will see why throughout this seminar on why that answer just doesn't fit. The general population receives their information from TV, friends or family, and the internet. And so not the same type of places that the health professions are getting them. So not journal articles, but a little bit of word of mouth, previous experiences. But what this is all kind of coming together to say, whether it's health professionals or general population, there is a need to learn a little bit more about probiotics. So with that, we're going to start off with the general definition. What are probiotics? They are live microorganisms that, when administered in adequate amounts, confer a health benefit on the host. So one part of this, they have to be consumed in adequate amounts to be able to provide that health benefit. Second part, on the host. So this can be humans, or I've given my own dog probiotics when she took an antibiotic treatment. So this doesn't just relate to human consumption. So they are live microorganisms. When administered in adequate amounts, confer a health benefit on the host. They can be found in supplements or food and drink products. I'm sure you guys have been down the supplement aisle and see all the different supplements. Or when you're walking down the grocery store aisle in the dairy aisle and we see Activia, billions of live and active probiotics, or other dairy products or other products that are containing these items. And so now that we know the definition, we kind of want to look at, well, how are probiotics classified? And Dr. Archer talked about this a little bit last time. We have genus, species, and strain. And so when we're looking at a probiotic combination, or sorry, a probiotic, we can look at Lactobacillus acidophilus NCFM. So Lactobacillus being the genus, Acidophilus being the species, and NCFM being the strain. However, this is all kind of, well, what does that necessarily mean? And to take a step back to kind of like visualize this and conceptualize this, if we look at the genus Canis, those are dogs, but the genus Felis are cats. So Lactobacillus and Bifidobacterium are kind of like cats to dogs. If we stay in the genus Canis, species Lupus are wolves, but you also have domestic dogs, so quite different even at that species level. And then getting down to the strain, you would think, oh, maybe Lactobacillus acidophilus NCFM versus Lactobacillus acidophilus XYZ are quite similar because you're following it down that line. But that's comparing different breeds, like comparing different breeds of dogs to each other. So the left-hand side, you have a cattle-dog mix. On the right-hand side, you have a lab. Well, the cattle-dog mix likes to herd people or nip at their ankles if they don't have a cattle around, whereas the lab likes to retrieve things. And so even at that level, there's different functions. So NCFM versus XYZ, we're going to have different functions that those probiotics have or those microbes have as well. And so now that we kind of can break down probiotic classification, when you're walking down the probiotic aisle, the next step is going to be to reading a probiotic label that you see. And this isn't an endorsement for Culturelle. It's one of the ones that we're probably all most familiar with. Popped up on Google right away. There's a lot of literature on it. And so we have the image on the left-hand side. And so the first thing that you'll see on a lot of them are the structure function claims. And so these describe the role of a nutrient or dietary ingredient intended to affect the normal structure or function of the human body. These types of claims are not pre-approved by the FDA, but the manufacturer must have substantiation that the claim is truthful and not misleading, and must submit a notification with the text of the claim to the FDA no later than 30 days after marketing. And so that we can see here for Culturelle, the structure function claims that we have works naturally with your body to keep your digestive system in balance, helps with occasional digestive upset, including diarrhea, gas, and bloating, and helps your digestive system work better. So these claims to be submitted had to have clinical studies to back them up. However, these boxes must also have a disclaimer that states that the dietary supplement products is not intended to diagnose, treat, cure, or prevent any disease, because only a drug can legally make such a claim. And the Culturelle is a probiotic supplement, not a drug. If a probiotic is going to be marketed as a drug for treatment of a disease or disorder, it has to meet stricter requirements. It must be proven safe and effective for intended use through clinical trials. It must be approved by the FDA before it can be sold to be considered a drug. So now that we've kind of covered the front of the box, going to the back of the box kind of looks like a nutritional facts label, except it has a supplemental facts. So it has a serving size, calories, carbs, sugars. And then right here, we have the species and strain of the probiotic. So Lactobacillus rhamnosus GG. So genera, species, strain, and the CFUs. CFUs are colony forming units or the number of viable strains, viable bacteria in the sample. And so what they recommend is 10 to the 6 CFUs of viable cells throughout product shelf life to be able to provide those beneficial effects. And most of them have more than necessary. So we have 10 billion CFUs per 40 milligrams. So right here we have a good amount, meets the recommendations, shows you what their strains are. If there are multiple strains or a probiotic combination, we would have each one listed here. Excuse me. And so today's today's seminar is going to be based on evidence. Well, a lot of the things that we talk about is based on evidence, but it depends on the quality of evidence out there. So structure function claims are based on randomized controlled trials. This seminar is based on randomized controlled trials, systematic meta-analyses, experiences. Recommendations can be anecdotal from your friends, can be popular press, word of mouth. And so it's really important to think about the level and quality of evidence. When you're making these recommendations. And so on the right-hand side, we have a pyramid with the quality of evidence. And so at the bottom is going to be the lowest quality of evidence that we have with anecdotal and popular press, followed by narrative reviews. Narrative reviews can contain literature that supports an answer and doesn't necessarily have to have literature that goes against what the authors want to talk about. We have case control or cohort studies and randomized controlled trials. So randomized controlled trials are where we're going to get these structure function claims from. And they are usually, sorry guys, They are typically placebo-controlled trials. And so this eliminates the bias of, oh, I'm taking a pill, I must be feeling better. And so these trials allow for you to distinguish between placebo and the effects of the probiotic. And then we have systematic and meta-analyses. And these will take case control studies, cohort studies, randomized control trials, and wrap them up and do a secondary non-bias analysis. They have to include both studies that had positive effects and both studies that had negative effects. And so a lot of the research that I'm presenting to you guys today on topics are based on the systematic and meta-analyses. My slide, here we go. And so the question today is, how are probiotics beneficial? We have gastrointestinal and immune function that we're going to be wanting to look at. These are two topics that I'm really interested in. I hope that you guys are also interested in. And the first one I'll be talking to you today about is gastrointestinal function. And so with gastrointestinal function, when I want to understand something or conceptualize it a little bit better, I need to look at a mechanistic view. And so I grabbed this slide from clinical gastroenterology and hepatology. And it's a picture of healthy intestines zoomed in. We have the intestinal cells, gut mucus, and then what's kind of going on in the intestines. And so different ways that the probiotics can work. We can stop harmful bacteria from attaching to gut lining. If the probiotics are there, it's going to make it harder for those pathogens or harmful bacteria to attach through competitive inhibition. They can also send signals to cells to build up gut mucus and act as a barrier against infection. They can stop toxins from being released by certain bacteria, and they can promote growth of other good bacteria. And so Dr. Archer had briefly talked about this last time with primary and secondary degraders. If we have carbohydrates moving throughout the intestine, those primary degraders are going to break down some of the larger carbohydrates so that secondary degraders can have a fuel source. So without those primary degraders, the secondary microbes won't have an energy source and wouldn't be able to prosper and grow. And so it's kind of a mutualistic relationship that they benefit from each other. And so if we have probiotics coming in, they can promote growth of other good bacteria. This was a question that was kind of asked last time. And I thought it brought up a good point and a good slide. And so the American Gastroenterological Association said they do not recommend the use of probiotics for most digestive conditions. And I kind of remember when this came out and I was a little confused. I mean, most of my research has been on probiotics until I kind of started looking at it a little bit more and the rationale behind this. And so I went to the website in the article that was published. And I made a summarized table for you guys that goes over the diseases that they talked about, the population, so adults, children, or patients, recommendations that they gave, strength of recommendations, and the quality of evidence. And so I kind of broke it down a little bit. So in order of quality of evidence and what they recommended. And so for C. difficile, Crohn's disease, ulcerative colitis, so inflammatory bowel diseases, or symptomatic irritable bowel syndrome, for adults and children, the recommendation for the use of probiotics is only with clinical trials. They do not give a recommendation for certain probiotics, and this is because there is a knowledge gap. And so we kind of think back about how even different strains can differ in their function. We can kind of understand why there is such a knowledge gap. There's research out there, but not on every strain, and some strains may be beneficial, some strains may not be beneficial. So it's hard to make that recommendation for these diseases if there's not enough evidence out there. Doctors like to practice evidence-based medicine. And so if there isn't evidence, they're not going to make a recommendation for it. So they are hoping that you continue with the clinical trials to maybe in the future have these recommendations. However, for pouchitis, which is the inflammation that occurs in the lining of a pouch created during surgery to treat ulcerative colitis or certain other diseases, prevention of necrotizing enterocolitis, or antibiotic treatment for prevention of C. difficile infection, not C. difficile itself, but the prevention of it in adults, children, or for NEC with preterm low birth weight infants. Recommendations are conditional, and they do recommend specific probiotic strains. And so these strains are listed on their website. The quality of evidence ranges from very low to low to moderate / high, depending on the disease. And so they are giving recommendations, specific probiotic strains on their website if there is enough evidence out there. For acute infection gastroenteritis in children, they recommend against it. Strength of recommendation is conditional based on population, and the quality of evidence is moderate. And they said the majority of data supporting the use of probiotics in children with acute infectious gastroenteritis were from studies performed outside of the United States and Canada, while 2 high-quality studies performed in the United States and Canada did not show any benefit. And so within the United States, with acute infection gastroenteritis, children were not seeing benefits. When we're looking out outside countries or other places, we were seeing benefits. And they said that given likely differences in host genetics, diet, sanitation, and endemic enteropathogens between North America and other global regions, as well as different causes of acute infectious gastroenteritis in children, they don't feel that the studies conducted in other regions can be generalized to the population served by AGA, and thus suggesting it's the use of probiotics. Again, this kind of makes some sense. If we're looking at different populations, well, AGA is seeing American children, and if the American children weren't seeing beneficial effects from the probiotics from evidence-based studies, they're not going to recommend for the use of probiotics against acute infection gastroenteritis. So as a whole, I understand where the AGA is coming from. We do have knowledge gaps in a lot of places, and they can't recommend these probiotics if we don't have sufficient evidence for them. So moving on from these statements, one of the first topics that I wanted to talk to you guys about was prevention of antibiotic-associated diarrhea. And so on this picture, you guys can see a healthy epithelial barrier, healthy mucus layer, healthy intestinal lumen, where in the intestinal lumen we have the probiotic bacteria, and we also have some diarrhea-causing bacteria. Diarrhea-causing bacteria is in the red, and the probiotic bacteria is in the green. Healthy epithelial, healthy mucus layer, doing their thing. Whereas during antibiotics treatment, antibiotics don't care what they're killing. So they'll kill the good and the bad bacteria. When you kill the good bacteria, those mechanisms that I previously showed that probiotics can be beneficial for in keeping a healthy barrier kind of disappear. We don't have that mucus layer necessarily intact as much anymore. There isn't as much competitive inhibition, and so these diarrhea-causing bacteria can interact with the epithelial and cause some diarrhea. What's not shown in this slide is when I was talking about the primary and secondary degraders, if we have carbohydrates that aren't getting digested, we do have the chance for osmotic diarrhea. So there are 2 possible mechanisms that antibiotics could cause diarrhea, with the diarrhea causing bacteria like C. difficile, or undigested carbohydrates for osmotic diarrhea. With the use of oral probiotics, we kind of take the place of maybe some of those dead bacteria, have a healthier epithelial barrier with the supplemented probiotics, maybe degrade some of those carbohydrates and prevent the attachment of the diarrhea-causing bacteria. And so this is all in theory, these ideas. So I wanted to look up, well, is this actually beneficial? Is this happening? Is there evidence for it? And so in the prevention of antibiotic-associated diarrhea, I found a 2020 meta-analysis. And since I had talked about, that quality of evidence that I wanted to give you guys, systematic reviews and meta-analyses are at the top of that. I'm not going to show slides every time of these results. I do have references at the back because it can get a little cluttered, but I wanted to show you what these secondary analyses look like. And so this was a meta-analysis of 22 randomized clinical trials. They subdivided it out by the type of probiotics. We have Lactobacillus rhamnosus GG, a Lactobacillus rhamnosus combination for the next 3. Then we have a different species, so Lactobacillus helveticus with 2 other probiotic combinations. And when they do these analyses down at the bottom, if you fall to the left-hand side, we favor the probiotic. If you fall to the right-hand side, you favor the control. And so each of these dots and lines represent the study and the variability within a study. So these large lines mean there was quite amount of variability. So some people really benefited and some people didn't, whereas these tight lines mean they had pretty similar results throughout the studies. And so when we look at Lactobacillus rhamnosus GG, there are subtotals for each of these sub-studies represented by this diamond here. And so Lactobacillus rhamnosus GG does favor the probiotic for prevention of antibiotic-associated diarrhea. And we can see it kind of falls along this line until we get to one of the probiotic combinations, and it falls to the right. However, when they did the whole meta-analysis and summarized all the effects of the probiotics, we do see that it does favor the probiotic. But this is why it's really important to look at, those label structure function claims or even research out there to where not all studies are the same and not all probiotics are the same. So in this study, they were typically given during antibiotic treatment for 1 to 3 weeks. Again, Lactobacillus rhamnosus GG was one of the main ones that they studied. It was effective combination or single strains, except for the 4-strain combination, which is right here. And so there is evidence by this recent meta-analysis that probiotics, certain strains and certain species, can help with the prevention of antibiotic-associated diarrhea. Now kind of shifting to irritable bowel syndrome, signs and symptoms include cramping, abdominal pain, bloating, gas and diarrhea, IBSD, or constipation, which is IBSC, or a little bit of a mixture of both, so diarrhea and constipation along with these other symptoms. And in a recent systematic review from 2019, they looked at fecal samples between IBS versus controls. And this kind of gives the rationale of why they should take probiotics or why probiotics may be beneficial in theory. Because we do see dysbiosis and microbial composition change in those with IBS. So we have a decrease in bifidobacterium and a decrease in Faecalibacterium with IBS patients. Bifidobacteria produces acetate, which is a short-chain fatty acid, which can also go then to feed Faecalibacterium, which then produces butyrate. Short-chain fatty acids are a source of energy for intestinal cells, and so they're also associated with anti-inflammatory, maintaining healthy intestinal cells, so overall healthy environment. So if we have a decrease in these cells, we have a chance or a risk for inflammation, and some other things going on. And so on the flip side, they saw an increase in Lactobacilliaceae, Bacteroides, and Enterobacteriaceae, after tongue twister of one. Bacteroides is associated with inflammation, which again ties into play with some of these irritable bowel symptoms, microbial dysbiosis. And so what has literature shown us out there? For a 2020 systematic and meta-analysis on the efficacy and safety of probiotics and IBS. Sounds a little similar to AGA. It was impossible to draw a determinate conclusion on the efficacy and safety in IBS. This is mainly due to the probiotic type, dose, treatment duration. They looked at 34 randomized controlled trials with about 4,400 patients, varying study lengths. 18 studies were less than 8 weeks, 17 studies were more than 8 weeks. We had a high dose and a low dose of probiotics, and what they considered a high dose was 1 billion. And we saw on the culturelle, it was 40 billion cells, CFUs. And so differing doses, and they also had a differing treatment duration, and they also had different probiotic types, whether it was a single strain or a probiotic combination, which makes it really hard with all these different study designs to draw a determinate conclusion on IBS itself. But what they did see is that there were improved global IBS symptoms versus placebo, and these symptoms include abdominal pain, bloating, gas, urgency for a bowel movement, incomplete bowel movements, and other bowel habits. They found that there was a beneficial effect with a shorter treatment, so less than 8 weeks of taking this probiotic. And I kind of thought to myself, okay, well, why is that? And they had discussed, well, these longer studies, it's harder to keep people from dropping out, adhering. So that plays a little bit into it, why we might have seen more beneficial effects with the shorter treatment, because people were adhering to taking their probiotics every day. There was no difference with probiotic dose, whether it was high or low, and single probiotic was more beneficial. And so this is all just kind of doing their secondary analyses, like on that previous slide that I showed you, where they look at these sub-study or sub-characteristics of the studies to make these conclusions. They found that individual symptoms of abdominal pain and bloating improved with probiotics with higher doses. And from adverse event reporting, probiotics were safe for patients with IBS. And so to do this, they looked at adverse event reporting between probiotics versus the placebo. And placebo did have more adverse events, and so therefore they can kind of say that probiotics were safe for patients with IBS. And kind of moving on from gastrointestinal function, I want to talk to you guys about immune function a little bit. It's a hot topic right now. Your gut health is very important to your immune health. It is a key player in immune response and function. The gut is your largest immune organ with a surface area equivalent to that of a small studio apartment. It is the largest and most dynamic immunological environment within your body. The gut immune system is key to maintaining a healthy gut as well as overall health. So you really want to keep those microbes in your tummy happy to keep you happy and healthy as well. Just like the previous one talking about gastrointestinal function, to conceptualize, I always like to see how this might be happening, keeping your tummies happy with those microbes, how this plays a role in immune function. So barrier integrity is one way, inhibition of pathogens, stimulation of the immune response, so in the normal development of immune cells and signaling. And so 1 and 2, I kind of previously talked about with enhancement of the epithelial barrier, increased adhesion to intestinal mucus. If we have that mucus layer or competitive inhibition, pathogens can't get in, can't interact with the intestinal layer, and we have less inflammation. Inhibition of pathogen adhesion, and so probiotics can also bind to toxins released by pathogens, resulting in neutralization of the toxins produced by those pathogens. They can also release toxic molecules to counteract pathogen colonization. The metabolites of probiotics, like lactic acid from Lactobacillus bacterium, can result in alteration of pH in lumen or at surface, which can ultimately inhibit the growth of a certain pH-sensitive pathogens like H. pylori. And so probiotics and microbes can change their environment to reduce the chance of those reduce the chance of adherence from those pathogens. Competitive exclusion of pathogenic microorganisms. If the probiotic's there, harder for those pathogens to get by. Production of antimicroorganism substances, which then can interact with the modulation of the immune system. So the binding of probiotics can induce the host to secrete anti-inflammatory cytokines, which then can decrease inflammation at the tissue surface. They can also help with the normal development of immune cells and signaling of those immune cells. So an anti-inflammatory response or an inflammatory response, depending on what they're sampling and telling what is going on in the gut, and they're telling to the immune system. So there's a direct communication from the intestines to the immune system. And so with these colder months going on, how could this help with cold and flu? I found 2 meta-analyses. Unfortunately, one's a little bit older, so 2014, and it was of adults and children. There were about 20 studies, and they were done in the winter months, so right when cold and flu is taking place. And they looked at Lactobacillus and Bifidobacterium, which are 2 of the most common probiotics to consume. Duration was 3 weeks to 7 months, so quite variable there. But they did find that there were fewer number of days of illness per individual and fewer number of days absent from daycare, school, or work. So they summarized this up altogether as adults and children and did find that there were beneficial effects relating to number of days sick and missing school or work, which a lot of people really don't want to do right now or in general. However, they didn't really have a mechanism for how this is happening. It's kind of hard to do all, the health outcomes and the mechanisms in these studies. And so they just looked at these health outcomes, tracked these patients for adults and children. Now, kind of going to an older subset of patients, we have healthy elderly, and they describe these as those individuals 60 years or older. They had a duration of 3 weeks to 3 months. They looked at 19 studies, different doses of probiotics, but they also did not do it in the cold and flu months. And like down at the bottom, they did not examine health outcomes. So what they did find is that was increased immune cell function with consumption of lactobacillus and bifidobacterium strains, more specifically polymorphonuclear cell phagocytic capacity, so the ability for these cells to engulf virally infected cells. And natural killer cell function is one of the innate immune responses, first line of defense against the virally infected cells. So we do see an increase in immune cell function with the consumption of lactobacillus and bifidobacterium. However, these individuals weren't challenged with the cold and flu, or weren't monitored to see if they did have protection against the cold and flu. So it's kind of hard to say whether these changes in immune cell function and immune cell function actually help, but in theory, they should produce similar results. But again, they did not examine health outcomes, so you can't necessarily make that conclusion. And so that's for cold and flu. We all have seen influenza vaccinations. You can go and get one. I already got mine. And so how can probiotics what is the interaction with probiotics and influenza vaccination? This was a recent study done in 2018. It had 12 studies, of which 7 were probiotics. They looked at lactobacillus and bifidobacterium strains at differing doses and durations, 2 to 28 weeks. They also examined prebiotics, which induce the growth or activity of beneficial microorganisms. And so prebiotics can help you grow those beneficial microorganisms, and the probiotics, you're actually just giving those microorganisms. They examine seroprotection rate and seroconversion, and seroprotection rate is defined as the percentage of vaccine recipients with a serum HAI titer greater than or equal to 40 after the vaccination, which is correlated with protection. So they were seeing who was protected, and the seroconversion is just going from negative to positive. So are you protected or are you not protected after this vaccination, along with consuming that probiotic or the placebo. And what they found was that with probiotics and prebiotics, both of them, there was an increased seroprotection rate and seroconversion for H1N1. They had increased seroprotection rate for H3N2 for both, and only seroconversion for probiotics. And they increased seroconversion rate for influenza B. So there is evidence based on this meta-analysis, although it's only 12 studies, that there is some potential for beneficial effects with probiotics in the influenza vaccination. What was really cool about the study is they explored it by age. And so they subdivided age categories, and they found that participants from the healthy older adult category had the best response, followed by healthy young to middle-aged adults. And then not the best response, but they still had a response, frail or hospitalized individuals. And I had to step back and kind of think about this, but it does make sense once you kind of walk through it. So healthy young to middle-aged adults probably are at the prime immune function. There probably isn't too much for them to improve upon if they are defined as healthy functioning adults. Those are healthy older adults might have a little bit of not as a strong immune function or strong immune response. So there is a greater likelihood that you could see an increase in this population. Whereas the frail or hospitalized individuals, if they're hospitalized, getting tube fed, they have so much other stuff going on that they are immunocompromised, that these probiotics most likely aren't going to have an effect because their immune system's already overwhelmed. And there was also the talk about, frail or hospitalized individuals, giving them these probiotics or prebiotics, could it lead to infection? And so they did look at adverse events. And they found since more than half the participants were bedridden, fed with the nasogastric tubes, or nursing home residents, they wanted to look at this, and no documented probiotic-related sepsis was reported. So they didn't have these adverse events with the probiotics, thankfully. However, the best age range probably to see a beneficial effect with the probiotics and influenza is that healthy older adult category, but you could probably still see some with the healthy young to middle-aged adults. And with the pandemic going on, I wanted to kind of look and see if there was any research with probiotics or immune function. And there is a study currently being conducted by Duke University Medical Center to assess probiotics and COVID-19 exposure. So doctors Paul Wishmer and Anthony Sung, which are the principal investigators of the study, say that they anticipate that probiotics show promise to directly reduce the risk of SARS-CoV-2 infection and severity of COVID-19 disease and symptoms in household contacts and caregivers of known COVID-19 patients. They had stated that the Wishmer lab and others have shown that probiotics such as Lactobacillus rhamnosus GG can improve intestinal and lung barrier function and homeostasis by by increasing regulatory T cells, improving antiviral defenses, and decreasing pro-inflammatory cytokines in respiratory and systemic infections. They have demonstrated that probiotics help in preventing ventilator-associated pneumonia in adult patients and decreasing the risk of upper respiratory tract infections in children attending daycare. And so with that rationale, they are conducting a study and they hypothesize that the Lactobacillus rhamnosus GG will directly influence the microbiota, which may in turn reduce COVID-19 infection and severity of disease and symptoms. The study will provide us with a greater understanding of how to care for the most at-risk populations. And so down at the bottom is the link to the article. And I also pulled up the clinical trials page to kind of see what they were looking at. So they have their rationale and brief summary at the top. They are giving Lactobacillus rhamnosus GG. It is an interventional placebo-controlled study. They are enrolling 1,000 participants and kind of watching them over a period of time. I couldn't fit it on this slide, but their primary outcome is to look at microbial composition. So can a more eubiotic state of microbial composition, healthy microbes, abundance of these short-chain fatty acid producers, help to prevent SARS-CoV-2 infection or have a better outcome compared to those with a dysbiotic microbiota? Or are there certain kind of diving into more specifics of the microbiota, which I thought was really interesting. So the big question, what probiotic supplement is best for you? I'm sure we've been asked this. It was one of the common questions. People don't know what to take. It's still a very individual thing, depending on your symptoms, what you're wanting it for. And you can go to AE Probio, which is the clinical guide to probiotic products available in the USA. It provides brand name, strain number, dose per day, and indication. So kind of what symptoms you're looking to alleviate, constipation, IBS, or mood, and it rates it based on level of evidence. And I left the link down at the bottom. Once you click on the website, it brings it up by finding the appropriate topic. You can click on adult health, pediatric health, women's health, or functional foods. Functional foods I didn't really get into, but a functional food is a food claimed to have an additional function by adding new ingredients or more of an existing ingredient that you wouldn't get from normal daily consumption. And so to be listed on this website, they must meet a certain amount of criteria. So they must be commercially available in the US. They must be generally recognized as safe, and they must have favorable published clinical evidence for particular strains present in each food or product. So not necessarily the same level of evidence that you saw from AGA, but more so the structure function claims. They do have levels of evidence, so based on how many clinical studies are out there. They must also for products containing multiple strains, the evidence must be for specified combination and not exploited from evidence for the separate probiotic strains. So meaning that probiotic X does this, probiotic Y does that, probiotic Z does this separately. If I were to combine them into a probiotic XYZ, they won't take that if you list the same health benefits that those individual strains had, because you have that probiotic combination hasn't shown the efficacy to prove those symptoms or improve those symptoms. And so it's a really cool guide. I went through it, saw what was available, and many of these ones that I've seen in the grocery store myself, and some that I didn't know had these clinical studies related to them. And so for today's take home, I hope that you guys are feeling comfortable looking at labels and structure function claims on how to read them, know what they're saying. understand that more research is needed. I mean, we're discovering so much about microbes in the intestines, how these probiotics, individual strains can differ from each other, and why one strain may benefit one thing and the other strain may not. But overall, they may be beneficial for GI and immune function depending on which one that you pick up. And then today's references and questions.
Okay, there were a lot of questions. So thank you for a really wonderful information-packed presentation. I think Dr. Dahl has helped answer some of them, so I'm going to go through the ones that I think are still standing out there. What foods, if any, contain prebiotics, or are they just found in supplement form?
Prebiotics, so prebiotics are usually, they have to have the scientific evidence behind them that they have beneficial effects and can feed beneficial strains. I'm not sure off the top of my head which ones are prebiotics. I've seen them mostly in supplement form or in conjunction as a synbiotic. I mean, fiber, if you have a diet high in fiber, fruits and vegetables, those are going to feed your microbiota. They have beneficial polyphenols, vitamins, fiber that helps to feed a healthy intestine.
Okay, that's great. And it looks like Dr. Dahl will be talking more about prebiotics also in our next session. So it's a great lead into that. A couple other questions about food. If you consume yogurt at the serving size stated, oh, let me start at the beginning. Would you get adequate amounts of probiotics if you consume yogurt at the serving size stated on the product?
I think that I have to look into, I would assume that if they have that structure function claim, that they would have an issue making that claim if it's not for the serving size that they give you. That's also a really good thing to double check. I would assume, because if you're looking at the probiotic supplement, it has 1 capsule per day or 2 capsules per day to make that structure function claim. So I would assume that it would have to be similar with food products, but I'm not an expert in those food products.
Okay, thank you. The questions are all still coming in. So are refrigerated probiotics better than non-refrigerated ones?
I don't think that there's a difference. They have to remain shelf stable and provide the amount of CFUs by the end of their shelf life to provide those beneficial effects regardless of how you maintain them. Just if you do pick up one that is refrigerated, make sure that you are refrigerating it, because there is a reason why maybe that one's not as stable as the ones that are on the shelf. So if you take it out, leave it on the counter, and don't refrigerate the ones that are needed to be refrigerated, you might increase or decrease the amount of viable cells. So I don't have a preference for whether, I don't think there's evidence out there really if refrigerated ones are necessarily better than non-refrigerated ones.
Is a probiotic supplement with a variety of strains encouraged for healthy adults and children to take?
I think that if you're consuming a normal diet, you're healthy, there's not necessarily a need to add the additional microbes because you're feeding your intestine with the fiber and prebiotics from your diet. If there are potential issues, symptoms that you want to alleviate, look for those specific structure function claims. It's not necessary, there's not research out there to say that it would hurt to take them on a normal daily basis, but definitely kind of look into that a little bit more. I won't recommend for it or against it necessarily based on literature out there. We have done some prophylactic studies. So potentially if you're taking them before you get stressed or you know that you're going to be stressed, it could prevent some of these symptoms from occurring. So if you're normal, happy, healthy, and not feeling very stressed, then maybe not. But if you do, like most of us probably are, it might provide some prevention for stressful situations and symptoms related to immune function or gastrointestinal function.
Can you take them continuously?
It's probably better to take them continuously. I think there's some studies. We normally do a 2-week washout between our probiotic studies. So meaning that when we're looking at carryover or how long that they survive in the intestinal tract, the probiotics typically, unless you're supplying them on a normal basis, they will get flushed out after a certain amount of time.
Are there benefits to taking different strains at the same time?
So I think it depends. There are some that contain a ton of probiotics, different strains. I would just, if you're looking for it for a certain thing, I would look for what the structure function claims and what research is behind it. Some studies show that individual strains may work better, whereas some show that the probiotic combinations work better. We don't necessarily know how they interact with each other. So if you're taking a probiotic combination with a ton of different strains, they may inhibit function of some, whereas some probiotic strain combinations can be beneficial to each other. So there's not enough solid evidence out there to necessarily say which one is better to take.
Okay, there are a couple of questions related to antibiotics and the time frame in which to take them after you take the antibiotics.
So a few of the studies, going back to that, I think they took, the length of the study was anywhere from like 1 to 3 weeks. So some of the studies took it prophylactically leading up to the antibiotics and throughout the course of taking the antibiotics, and then continuing with it afterwards. So since the study designs kind of all differed, I think that you would be able to take them during the course, maybe a few days leading up to it, but most of us don't know when we're going to be getting antibiotics and then taking them a few days or continuing them after you end that antibiotic treatment.
Is there enough information at this time on what foods offer what strains? For example, if I made homemade sauerkraut or bought some at the store that does not specify the strain, would I know I was getting a certain strain?
I think there's certain starter cultures for foods like kombucha and sauerkraut and things like that. So they usually have the starter cultures. I don't know. I'm sure I don't personally know off the top of my head a resource out there to tell you what strains are in those without them specifying it. They mostly say live active cultures within it, but there is usually a particular starter strain that people use or companies use.
Okay, it looks like that answered another question that we had about food-based probiotics and making homemade yogurt and things like that, it looks like. Team, am I missing anything out there?
Not that I can see.
Okay, I think that is a wrap on all of our questions.